Does the type of anesthesia affect surgical risks during cosmetic surgery? Have you ever wondered if the type of anesthesia used during cosmetic surgery can impact the risks involved? The answer is yes, it can. The choice of anesthesia is influenced by several factors, including the type of procedure, the patient's health, and the surgeon's preferences. General anesthesia is often used for more extensive surgeries. This type puts the patient into a complete state of unconsciousness. While it allows for a pain-free experience and enables the surgeon to perform complex procedures, it does come with risks. These risks can include respiratory complications, cardiovascular stress, and adverse reactions to the anesthetic agents used. Some modern anesthetics have been linked to specific organ risks, such as kidney damage, but these instances are rare and often depend on the patient's overall health. On the other hand, local anesthesia is typically reserved for minor cosmetic procedures. This type numbs only the area being treated while keeping the patient awake. Since it affects a smaller area, it usually presents fewer systemic risks compared to general anesthesia. However, there is still a chance of allergic reactions or local complications, such as prolonged numbness or nerve injury. Another option is sedation anesthesia, also known as monitored anesthesia care or twilight sedation. This method keeps the patient relaxed and pain-free while still conscious. It reduces some risks associated with general anesthesia but requires careful monitoring to prevent issues like respiratory depression or inadequate sedation. When considering anesthesia, several factors come into play. Patient-related factors, such as age, medical history, and the function of the kidneys or liver, can affect how well anesthesia is tolerated. The complexity of the procedure matters too. Longer and more invasive surgeries typically requiring general anesthesia, which carries higher risks than local or sedation options. The specific anesthetic agents used also have varying side effect profiles. For example, while volatile anesthetics may impact kidney function, local anesthetics can lead to toxicity if not administered correctly. Additionally, the quality of monitoring and support during the procedure plays a significant role in managing risks, regardless of the type of anesthesia chosen. In cosmetic surgery, anesthesiologists and surgeons work closely together to select the safest anesthesia type tailored to each patient and procedure. This collaboration aims to balance comfort, surgical conditions, and risk minimization. A thorough preoperative evaluation is crucial to identify any potential anesthesia-related risks and ensure patient safety. In summary, the type of anesthesia does indeed affect surgical risks during cosmetic surgery. General anesthesia typically carries higher systemic risks compared to local or sedation anesthesia. However, the safest choice ultimately depends on individual patient factors and the specific requirements of the surgery. Proper management and monitoring of anesthesia are essential to minimize risks and achieve successful outcomes in cosmetic surgery. Always consult with healthcare professionals for personalized advice regarding anesthesia and surgical procedures.